Well, welcome back. Our next Impact Health Matters event is coming up, and we're joined with one of our partners for this important event during American Heart Month.
University of Maryland Capital Region Health has one of the top heart and vascular programs, and here to share more is Dr. Jamie Brown, who is the Medical Director of Cardiac Surgery. Welcome to Great Day.
Thank you. Good morning.
We talk a lot about heart health, especially in this month, in February, but before we get into what your program's all about, you say heart issues, heart concerns, it's a silent killer that many of us need to just be aware of.
It is a silent killer, and it hides in plain sight. Often, heart disease has no forewarning, and it comes upon people out of the clear blue sky. Now, these days, we have a lot of great solutions, a lot of great medical technology. A lot of it's minimally invasive and life-saving. So there really isn't any reason to play the game of ostrich or be stubborn or not pay attention to little symptoms.
When it comes to matters of the heart, you say there are no minimal risks. This is a major part of your body function, and you cater to patients who need services in a unique way. Can you tell us about that?
That's exactly right. So everything that is done that's a life-saving procedure is really important. And by risk that's minimal, having a toenail clipped is minimal, right? 1% is not much of a risk, but typical open heart surgery these days now has gotten so safe, although not minimal, that the risk may be just 1%.
Wow.
Same with a catheter-based procedure that our colleagues, the cardiologists, may do with a stent in the heart. That risk may be 0.5% or less.
The Heart and Vascular Care program that you are part of building it and restarting it from the ground up. What has been your goal and your mission to be able to provide to the patients?
So this mission started about 5 years ago, and the University of Maryland wanted to have a couple of volunteer missionaries to go in and kind of put the bar of quality and safety where it needed to be, and that was the theory. So the thinking there is, at least in my simple mind, is always about the patient first and working out from the patient what is literally everything they need from the standpoint of healthcare process. And that involves healthcare providers, equipment, spaces in hospitals, and all of that. How does it interact in the episode of care for each patient? That was how quality of healthcare was first defined long ago. So that has been our working guiding light, if you will. It's worked out well.
You all are the experts in the field and the procedures, but the patient is the expert in the need.
Absolutely.
Yeah.
I like that, because when you think about someone going into the hospital facing major surgery, they've got so much going on, on the inside from a mental health standpoint and a physical health standpoint. I really commend you for saying you want to take care of the whole person. You have a coronary artery bypass grafting procedure that you all are specialists at in Prince George's County. Can you tell us a little more about that?
As I often say to the patient, it's really just plumbing for the heart.
Plumbing for the heart.
The heart needs more oxygen than any organ in the body. It's got to pump millions and millions of times over a lifetime, but even during the course of a day sitting around, the heart needs a lot of oxygen. So in its 3 coronary arteries, it's common in the human race to have them be blocked. And when they're blocked, a cardiologist can open them up with a stent, but still, after all the years of evidence and studies and research, coronary artery bypass grafting, if all 3 arteries are blocked and a bunch of other specific criteria, is still the first choice if the patient can undergo surgery safely, and usually that is the case. So the idea of surgery is to take some artery from inside the patient, maybe some vein from the leg, maybe some artery from the arm, and use those things to do the plumbing job, which is jump around the blockages, plug in downstream, and give the heart the blood flow and oxygen that it needs to stay out of trouble, stay out of heart failure, stay out of heart attack, sudden events, and maintain quality of life.
And you all just treated your 300th patient last year. Congratulations. Of course, there's been some since then, but I know the patients and the doctors, you all, it's such a scary time for the patient. So to have doctors that are there for them has got to be so important. Look at that, all your the crew that you have out there.
Great crew.
It was a great event. We're approaching 400 operations now.
Wow.
And I think to do heart surgery, if you picture an orchestra, it takes that many people to make it work
Yeah.
and make it work well.
It takes a village, and people are going to be able to meet you and the team of specialists next Thursday,
Yep.
February 21st, and get some life-saving information. Thank you for sharing with us today.
Absolutely.
Dr.
My
Berlin,
pleasure.
thank you. If you want more information on the heart and vascular health services offered in Prince George's County at University of Maryland Capital Region Health, visit umcapitalregion.org.
And we are holding another Impact Health Matters Expo on Thursday, the 21st. It will be at Kentland Community Center on Pine Brook Avenue in Landover.
If you want more information on the free tests being offered, they're free, and how you can register, just head on over to our WUSA 9 mobile app or website. We hope to see you there. We'll be right back.